From Monday to Friday, the NHS is all go, moving non-stop to take care of patients. But at weekends, things start to slow down. And according to the Health Secretary, that system is costing lives.
No one could possibly say this was a system built around the needs of patients. And yet, when I pointed this out to the BMA, they told me to get real. I simply say to the Doctors' Union that I can give them 6,000 reasons why they, not I, need to get real on this.
And here are his 6,000 reasons, because the government says that's the number of lives lost every year because of a lack of senior staff at weekends. Patients are 15% more likely to die if they're admitted on a Sunday compared with a Wednesday, while 11% are more likely to die if admitted on a Saturday.
Let's not focus on one group of staff and cast them as the roadblock, when in actual fact it's consultants like me, like my colleagues, who at present are actually working the nights and weekends to keep the NHS running.
At the moment, hospital doctors can opt out of 7-day working, but the government wants to scrap that with a new consultants contract, forcing new doctors to work weekends. There are questions, though, about how a 7-day NHS service will be funded when the system is already stretched. The government set aside £10 billion, but some believe that's only enough to cover the bare minimum, let alone including resources on weekends too. You say it's about saving lives, but can you assure us that that won't then affect the death rates Monday to Friday?
Yes, because we can see from the work we're doing to improve hospital safety that we are reducing the avoidable deaths across the NHS. But what can never be right is to have a system where you crank down services on a Friday afternoon, crank them up on a Monday morning, and what everyone who runs hospitals say is the safest thing for patients is to have a regular, even flow.
So the aim is to have 7-day momentum throughout the NHS. But whether that's visionary or unrealistic depends which side you talk to.